The NIH is the public's investment in biomedical research, and it is the single largest engine for medical research, and it has been the driving force behind so many discoveries over the decades. We led the completion of the Human Genome Project, which has transformed the way we do science and study health and medicine. Nobody else is going to invest that amount in the basic research that is so necessary to answer questions and develop treatments and other strategies to address health and disease. And we cover a full spectrum of health. And sometimes you have maybe things you wouldn't even think about, like fluoride in the water, which helps prevent cavities, NIH research. And then to more serious conditions such as heart disease or stroke or cancer, statins for heart disease, blood-thinning drugs for stroke, cancer, chemotherapy, and immunotherapy, NIH research. And if you look at infectious diseases, the flu, something as common as the flu, we're looking at a universal flu vaccine. We're looking at a vaccine for Zika. We've been working on one for Ebola. So again, we're working on so many things that people may just take for granted. Oh, they show up one day, or they go to their doctor and they are able to get this. Well, where did this come from? Way back when, it came from supporting NIH research. I think it's important to connect the dots. In other words, people may have heard of Johns Hopkins or Mayo Clinic, and they think all the research that's being done there is supported by those institutions. To a large degree, they've received their funding from grants that they received from NIH. And I think it's important to explain the full enterprise of biomedical research. And of course, philanthropy plays an important role, private industry does as well, but you can't really replace the amount of funding that comes from NIH itself. John Burklow, Communications Director at the National Institutes of Health.